If your dog does this, get to the vet ASAP. Our dogs can't tell us when they're truly suffering. They rely on us to be their voice, to recognize the subtle signs that something is terribly wrong. Ignoring these signs can have devastating consequences. This isn't about minor issues. It's about the critical red flags that demand immediate veterinary attention. This information could save your dog's life. We're going to cover the warning signs that should never be ignored. Knowing these signs and acting quickly is crucial for your dog's health and well-being. Is your dog suddenly acting like a different animal? Extreme tiredness, a reluctance to move, or an inability to get up are not normal. Don't dismiss this as just a lazy day. Severe lethargy can indicate a serious underlying problem. Labored breathing is a terrifying sight. Listen for rapid, shallow breaths or excessive panting even when your dog isn't hot or stressed. Persistent coughing, especially if it sounds wet or raspy, is another major red flag. Blue or purple gums are an emergency. A dog who normally devours their food suddenly turning their nose up is concerning. Complete disinterest in food, and more critically, water, is a serious problem. Dehydration can set in quickly, compounding the underlying issue. Don't wait to see if they perk up later. Occasional vomiting or diarrhea might be a minor upset, but frequent episodes, especially if accompanied by blood, are a clear sign of distress. Blood in vomit or stool indicates internal bleeding or severe inflammation. This requires immediate veterinary intervention. Healthy gums should be a vibrant pink color. Pale, white, or bluish gums are a sign of poor circulation or blood loss. This is a critical warning sign that should never be ignored. It often indicates a life-threatening condition. A suddenly bloated or swollen abdomen can indicate a number of serious problems. This could be fluid accumulation, organ enlargement, or even a twisted stomach. This is especially dangerous in large, deep-chested breeds. Seek immediate veterinary care. Seizures are a neurological emergency. Even a single seizure warrants immediate veterinary attention. Tremors, shaking, or muscle twitching can also indicate serious underlying issues. Don't wait to see if they stop on their own. A sudden inability to walk or put weight on a leg is a sign of significant pain or injury. This could be a fracture, a torn ligament, or a neurological problem. Don't try to diagnose the problem yourself. Get your dog to a vet immediately. Straining to urinate, producing very little urine, or blood in the urine are all signs of urinary problems. Similarly, difficulty defecating or changes in stool consistency should be investigated. These issues can quickly become life-threatening. Prompt veterinary care is essential. Redness, excessive tearing, discharge, or squinting can indicate a serious eye problem. Glaucoma, corneal ulcers, and other eye conditions can cause permanent vision loss if left untreated. Don't delay in seeking veterinary care for eye issues. Early intervention can save your dog's sight. If your dog suddenly collapses or loses consciousness, this is a medical emergency. This could be caused by a heart problem, a seizure, or a number of other serious conditions. Get your dog to a vet immediately. Time is of the essence. Excessive drooling or foaming at the mouth can be a sign of poisoning, a foreign object stuck in the throat, or a neurological problem. This is especially concerning if accompanied by other symptoms. Seek immediate veterinary care. Don't try to remove a suspected foreign object yourself. Nasal discharge that is bloody, pus-like, or foul-smelling can indicate a serious infection or even a tumor. This is not just a simple cold. Prompt veterinary attention is needed to diagnose and treat the underlying cause. Swollen lymph nodes, especially in the neck, groin, or behind the knees, can be a sign of infection, inflammation, or cancer. This requires veterinary investigation. Don't ignore swollen lymph nodes. They are often a sign of a serious underlying problem. Sudden changes in behavior, such as aggression, confusion, or disorientation, can indicate a neurological problem or a systemic illness. This is especially concerning if your dog is normally well-behaved. Seek veterinary attention to rule out any underlying medical causes. Jaundice, or yellowing of the skin, gums, and whites of the eyes, is a sign of liver problems or red blood cell destruction. This is a serious condition that requires immediate veterinary care. Don't wait to see if the yellowing goes away on its own. Open wounds or sores that don't heal properly can become infected and lead to serious complications. This is especially concerning if the wound is deep or located in a sensitive area. Seek veterinary care to ensure proper wound cleaning and treatment. If your dog cries out or flinches when you touch them in a certain area, this is a sign of pain. This could be caused by an injury, arthritis, or another underlying condition. Avoid touching the painful area and seek veterinary care to determine the cause of the pain. Unexplained weight loss, despite a normal appetite, can be a sign of a serious underlying illness, such as cancer, diabetes, or kidney disease. This requires veterinary investigation. Monitor your dog's weight regularly and report any significant changes to your veterinarian. Persistent skin problems, such as excessive itching, hair loss, or skin lesions, can be a sign of allergies, infections, or parasites. These issues can significantly impact your dog's quality of life. Seek veterinary care to diagnose and treat the underlying cause of the skin problems. Lethargy and weakness can stem from infections, anemia, or even organ failure. Breathing issues might point to heart disease, pneumonia, or a foreign object lodged in the airway. Loss of appetite can be triggered by infection, pain, or gastrointestinal problems. Vomiting and diarrhea could be caused by toxins, infections, or intestinal blockages. Pale gums are often a telltale sign of blood loss or anemia. These are just a few examples. The underlying causes can be complex and require a veterinarian's expertise to diagnose accurately. These warning signs are not to be taken lightly. Every minute counts when your dog's health is at stake. Early diagnosis is crucial for successful treatment. The sooner you seek veterinary care, the better the chances of a positive outcome. Prompt action can prevent further complications and minimize long-term damage. Don't delay, hoping the problem will resolve itself. Maintaining your dog's quality of life is paramount. Early intervention can help ensure they live a long, happy, and healthy life. The underlying condition can rapidly worsen if left untreated. What starts as a minor issue can quickly escalate into a life-threatening emergency. Delay can lead to irreversible organ damage. This can have long-term consequences for your dog's health and well-being. More advanced conditions require more expensive and intensive treatment. Early intervention can save you money in the long run. In severe cases, delay can be fatal. Don't risk your dog's life by waiting to seek veterinary care. Never attempt to self-treat your dog without veterinary guidance. Home remedies can be ineffective and even harmful. Carefully monitor your dog's symptoms and keep a detailed record to share with your veterinarian. This information can help them make an accurate diagnosis. Contact your veterinarian immediately if you notice any of the warning signs we've discussed. Don't hesitate to call, even if you're unsure. Adhere to your veterinarian's recommendations for treatment and care. Follow their instructions carefully to ensure your dog recovers fully. And if you found this helpful, don't forget to subscribe, like, comment, and share to help more dog lovers take better care of their furry friends.